Hello, everyone. Welcome to today's class. Today, we're going to be talking about vital signs, which is simplified for nursing students. So, what are vital signs? Well, vital signs are key measurements that reflect the body's essential functions, and they indicate the health status and detect potential problems very early. So that is why it's actually very good for patients to always come for regular checkups, for patients to always do their vital signs as they're entering the hospital or the clinic where you are at. So what are these vital signs? Well, there are so many others, but the four major ones that are normally to be done, we have the temperature, respiratory rate, blood pressure, and pulse heart rate. So we're going to talk about each and every one of them. So the first one is temperature. What is the temperature? Temperature, I'm sorry I did not write about it, but temperature, this is the measuring of how hot or cold the body is. And the normal range for temperature, we have 36.5 degrees Celsius, which is approximately 97.7 degree Fahrenheit to 37.5 degrees Celsius to 99.5 degree Fahrenheit. So here in Nigeria, we use Celsius, while those in the UK, US, they normally use Fahrenheit. So you just have to know how to convert it whenever you find yourselves in any of these areas. And these thermometers, how do we measure the temperature? We use what we call thermometer. And the thermometer can be placed in so many parts of the body. We have the oral, which is inside the mouth, or the rectal, which is inside the anus, or the axillary, which is under the armpit, or the tympanic, which is in the ear, or the temporal, which is beside the forehead. And these are the terms to know. We have the hypothermia, which is below normal, fever or pyrexia, which is above normal. So when somebody is having below 36.5, the person is hypothermic. Person could be feeling cold. While when we have somebody that is having fever or pyrexia, the person will be having above 37.5 degrees Celsius. And clinical tips to always note the method used. Always know which method the person had done, because all these places that we measure with the thermometer, whether orally, rectally, or axillary, they usually give different readings. The same body, the same person, different readings. So you just have to know what part of the body was used to take the temperature at that time. And we have so many types of thermometer. We have the digital probe thermometer. I think we normally see this in Nigeria, and the mercury in glass thermometer. These are the two, plus the wall thermometer, the three that we normally see in Nigeria. But the digital temporal probe thermometer, yes, we do see it, but it's not actually rampant as the others. So these thermometers, aside the wall thermometer, the remaining three can be used to take the reading of how hot or cold the patient may be feeling at the time, while the wall thermometer measures the hotness or coldness of the room. So that is how we get our room temperature. We're moving on to the next, respiratory rate. So respiratory rate, this is actually measuring the breathing, the rise and fall of the chest. How is the person breathing? And the normal range is for an adult is 12 to 20, while for pediatrics, newborns, infants, toddlers, they have their so many ranges. And things to watch for while counting our respiratory rate. The rhythm, is it regular? Is the rising faster than the falling? The effort, is the person having a difficult time breathing in or out? And the sounds, while the person is breathing, are you hearing any sound while the person is breathing? Because as you're listening to me right now and you are breathing, are you hearing any sound? No. You actually don't even remember that you are breathing. So most times some people have difficulty breathing. That is when you hear sounds like wheezing, crackles, and the rest of that. So moving on to the next, we have the blood pressure. So the blood pressure, this is the measuring of the amount of pressure passing through the arteries, and it is usually measured in millimeter mercury, millimeter, Hg mercury, so millimeter mercury or millimeters of mercury. And this blood pressure gives us two numbers, one at the top, one at the bottom. And the one in the top is the systolic, and this is when the pressure of the heart beats. This is when the heart is having pressure while it beats. While the diastolic, this is the pressure when the heart rests. So what pressure will the heart be at when it is resting? So the normal blood pressure is 120/80. It should not be above this. It can be lower, it can be 170, it can be 90/70, but it should not go below 90/70, I believe, and it should not go above 120/80. Once it is above 120/80, maybe 130/90 or 130/100, that person could be having mild stage of hypertension. That is a topic for another day. So the tools used in blood pressure, we have the sphygmomanometer. Sphygmomanometer. Most people usually have difficulty pronouncing this. We have the stethoscope or the digital BP monitor. So the sphygmomanometer, for the short name, is called sphig. So for the sphig and the stethoscope, these two go together. The sphygmomanometer is what you wrap on the patient arms, and the bulb is what you press while trying to inflate the sphig. And this thing that looks like a timer there is what actually you look at while puffing up, while inflating the cuff of the sphygmomanometer. And the stethoscope is what you put in your ears to listen to the beats. While the digital BP monitor, this one you just wrap the cuff around the person's arm. It's digital. From the name digital, it works by itself. So you just need to wrap the cuff around the person's arm and press the start button, and it reads. Once it is done reading, it will show you the numbers just as it is displayed here. So a very, very important tip to note, please always choose the correct cuff size, and the patient should be calm. So usually while a patient walks in into the clinic or into the hospital, before we commence vital signs, we normally ask the patient to sit down for 3 to 5 minutes. This will give time for the patient to become relaxed, for the patient to become more calm, and to avoid us getting wrong readings, because any activity we do, our blood pressure shoot up. Just as I am talking, my blood pressure is shooting up. No, although it's not going to shoot up past 120. That's just it. But it is rising. As you walk on the road or even going to go and drop your cup in the kitchen, your pressure is going to rise. As you are moving about doing one or two things, your pressure is going to rise. So that is why whenever we want to check someone's blood pressure, especially blood pressure and respiratory, we normally ask them to sit down and wait for 3 to 5 minutes. Moving on to the next, we're going to be talking about the pulse. The pulse, which is also known as the heart rate. The pulse is a rhythmical throbbing of the arteries as blood pass through them. So the pulse and the blood pressure normally go hand in hand. Normally in a digital sphygmomanometer, a digital blood pressure monitoring device, you would normally see the pulse reading also, because you just need to place your hand on an artery. I forgot to tell you, sorry. The blood pressure, when you wrap the cuff around the person's upper arm, upper left arm, there is an artery there that this cuff is going to be placed against, which is the brachial artery. And we can see it here, brachial arm, just as the pulse heart rate here, the brachial arm. So the brachial artery, that is the artery that we would be able to get the pressure of the heart. And from that artery too, you can also get the pulse rate. Do you understand? And now moving on to pulse heart rate. It is the rhythmical throbbing of the arteries as blood pass through them. The normal ranges is 60 to 100 beats per minute. And the common pulse site, we have the radial, which is the wrist, as we can see in the image here. You can see the person is putting his two fingers on the radial artery. The brachial, which is found in the arm, where I told you about the upper arm. Carotid is by the neck. Temporal is forehead side. Popliteal is at the knee back. So what are the characteristics of a good pulse heart rate? The rate of a good pulse, sorry, of a pulse. Rate, rhythm, strength. This is what you check for. Is the rate fast? Is it fast? Is it faster than normal? Whereby we're getting above 100. This person is going to be termed tachycardia. Is it slow? If it is below 60, some books will tell you a normal pulse can be from 50 to 100, but majority of the textbooks I have read, they normally say 60 to 100. So I'll stick with 60 to 100. So when it is below 60, it is termed slow, which we call it bradycardia, Bradycardia. The rhythm, is it regular or irregular? When you check your pulse, you will see that there's a rhythm it follows, just like a music. When the music is playing and suddenly the thing goes out of tune, you would notice for sure. So that is the same thing with pulse. Then the strength, is it bounding or weak? Bounding in a sense like you are feeling the pressure, it's really high. Weak in a sense that you can't even feel anything. It could be that the person is having some sort of bleeding or something somewhere. Now, how to measure vital signs step by step. So, first of all, you introduce yourself. I'm sorry it's not here, but firstly you introduce yourself to the patient. Hi, I am nurse this, and I would be the one in charge of taking your vital signs. May I go ahead? Then the patient or the client will tell you to go ahead. If you do not seek consent from your patient, it is termed as battery. When you touch your patient, when you touch your patient without consent, it is termed battery in your nursing ethics. That is what we call it. So after seeking consent, a positive consent, to be sure, positive consent, the person told you, the patient or client told you, you can go ahead. Then you continue, you wash your hands. After washing your hands, you explain to this patient, this is what I'm going to do, this is how I'm going to do it, and this and this. Then the patient should have full knowledge about what you are going to do to him or her. After explaining, you provide privacy, whereby you screen the patient, making sure that the patient has privacy to him or herself, so that other prying eyes will not be looking at the patient as you are taking the person's reading. Then after providing privacy, you measure the person's vital sign. Is it blood pressure you're checking? Is it the temperature? Is it the pulse? Is it the whatever? After measuring, you record. Always record. That is one of our most important rule as a nurse. Always record your findings. Always, always, always record your findings. And this brings us to the end of Vital Signs. Thank you. So you can access free quizzes at nursingwithcharity.com.ng to test what you have learned today. Bye.